would like to introduce our wonderful second session where we will hear from somebody who's absolutely well known in our community and hardly actually needs an introduction, but I'm still going to introduce him here. Dana Francis, who is a clinical social worker at the Hemophilia Treatment Center at the University of California in San Francisco, where he works with people of all different ages with bleeding disorders, as well as their family members. Dana has been a staple in our community and has greatly contributed to many of our educational events, to publications, and is also a recipient of many awards and the Social Worker of the Year award as well. So with this, I would gladly hand it over to Dana for this wonderful next session. So please enjoy.
Thank you very much, Lena. It's really an honor to be here. I find myself saying this more and more as I move further into my career, but I'll just say it up front. This is my 33rd year of working in the hemophilia community, and it has been nothing but a privilege to do this work for the whole time. I don't even know how else to say that, except that it's been a huge privilege. Today, I've been asked to talk a little bit about mental health, and I'm going to kind of do a mental health 101 type of presentation. Keep it pretty basic. I also was asked to kind of connect this to COVID and to the issue that we're all facing now of re-entering the bigger world after being in isolation for so long. And when I was thinking about this, I thought about the issue of just of a little bit of PTSD, of you know, dealing with shutting down our lives kind of by force and then having to go back out into the world and figure out how to be out there again, whether that be in a public setting, with our families, with our friends, with our colleagues, that kind of thing. And one thing I thought about was just that when I started working in hemophilia in the late 1980s, there was a similar kind of a set of circumstances for very different reasons, but because of HIV and hepatitis, there were a lot of parallels to COVID in this way. People had a virus that no one understood. There was the added piece of homophobia in our community because a lot of gay men were getting sick with the same virus, and people really had to wrestle with what that meant to them. And people were very isolated from each other. I know when I started working, I tried to get some men's support groups going because I knew our guys with hemophilia were very emotionally isolated from one another. And I think, as we all know, when a big trauma like this happens in the world, that's when we need each other even more. And yet the pathways to get that contact with other people are more difficult. It's questionable how safe they are sometimes medically. And so we really have a challenge on our hands. I just kind of wanted to make that parallel though, because I know during COVID last year and early this year, I did talk to some of our older guys and women who were lived through the AIDS epidemic. And there was a lot of trauma, even now, for them, remembering what it was like back then and kind of reliving some of that traumatic stuff all over again. So just wanted to mention that. Another thing that I think is very important to talk about a little bit is the strange schism between physical health and mental health. I'm here to tell you there shouldn't be any difference. I was thinking today, if you call 911 or if you call an office in a hospital, they say, if this is a medical emergency, call 911. And what is a medical emergency? Well, it could be a physical emergency. It could be a mental emergency. It could be a psychiatric emergency. And the point that I'd like to make about that today is that there's a lot of stigma attached to mental health and mental illness challenges. And every one of us has suffered a little bit from depression or anxiety at some point in our life, but the world looks at it very differently. If you break your leg, they're going to want you to come into the ER, and they're going to want to x-ray it, and they're going to want to look at what's going on and help you get your leg fixed. If you're severely depressed, they may not know exactly what to do with you in the emergency room. And you're going to carry, and your family's going to carry some strange feelings and guilt and stigma about the fact that someone is depressed in the family, when in fact, it's a very normal thing, and there shouldn't be any differences between the two. Like I said a minute ago, we've all been depressed from time to time. Many of you are familiar with some of this terminology that I'm going to use now, so bear with me. But there are different kinds of depression. There's something I call situational depression, which is just based on things that are going on in your life. You're trying to find a job and it's taking a long time, or somebody's ill, or a family member passes away, and for a while you're struggling with your mental health issues because of that. There's also clinical depression, which is something that you might be diagnosed for by a licensed social worker or a psychologist or a psychiatrist. That tends to be a more serious, a deeper depression. Oftentimes people in this era are recommended to maybe take some kind of antidepressant medication that has to be prescribed by a physician. Sometimes that's exactly what's useful for the person at that time, is just to kind of help take the edge off of that depression. I know patients and friends and family members who are on antidepressants for a long period of time because it alters the brain chemistry a little bit and just offers some relief. And I think that's a big decision that people get to make, and you really need to make it with your, well, you would maybe talk with your primary care doctor about it, and also get a referral to a psychiatrist who could just help you understand what the medication's for, how it might help, you know, the titrating up or down depending on getting on it or maybe later getting off of it. But just it's not to be played with. It's not, you have to have a prescription to get it, and when you get on it, sometimes they have to tweak it to get it to a place where you feel like you can function with it. I'm going to give you a very quick bias of mine because I'm kind of old school, but I'm a big fan of having that discussion with your doctor, and also giving talk therapy a try, because the medication in many instances can be useful, and sometimes it's not necessary. But if we don't do some mix of that, or at least try to talk with someone about our issues, I don't think it's this is just my opinion, but I think it's really important to, you know, look at the whole wide variety of options that you have, and come up with something that's going to work for you. So I definitely wanted to just talk about that stigma that's there. It's really, it's deep. And I was thinking recently, I bet a lot of you saw this news about Naomi Osaka, who's the tennis pro who recently backed out of the French Open because she felt like her mental health was a little fragile, and she didn't want to be exposed to all the pressure of the press talking to her right after the match and probably before the match. And she got a lot of heat for it. And what was really surprising to me and hopeful to me was that a number of professional athletes came in to support her. Michael Phelps, the Olympic swimmer who won so many gold medals, who has suffered from depression himself, and in recent years has come and gone public with that and been a great advocate around the kinds of things I'm talking to you about right now. And also, which was shocking to me and also very hopeful, was a couple of professional basketball and football players who, you know, played very competitively at a high level and said, we understand what she's talking about. And we felt that way sometimes too when we were playing. And we support her in taking control of her situation and doing what she needs to do to be okay. And what they were doing, of course, is validating that there should not be a schism between one's physical health and one's mental health. So that was it doesn't seem like that big of a deal, but when these public figures step forward and say, yeah, I have been, I felt depressed too, and I have felt under enormous pressure, and I didn't know how to handle it. And what that does, obviously, is it tells all of us this is common. It's not, there's nothing wrong with this. It's really important to not hide it, not stuff it, and try to get some help. Okay. Another concept that I wanted to just bring up today that has to do with mental health, and particularly during this COVID period, is the issue of grief and grieving. Now, I know a lot of you have thought about this stuff over the years, and you've had times with your families when you've lost grandparents or parents or friends or siblings even. And what I wanted to just make sure to point out today about grief is that it's a process, and it's about so much more than just the loss of a loved one. Okay, so for instance, it could be, grief could be applied to the loss of many, many things. The loss of a job, being out of work, the loss of, in the COVID era, the loss of the freedom of movement to be able to go out and do the things that you're used to doing. The loss of being able to see your friends in the past 16 months. The loss, this is going to sound a little far-fetched, but the loss of our routines, the things that we were so used to doing, and then overnight, basically, people said, you can't do that anymore. You can't go to stores, you can't go to restaurants, you can't go to sporting events. We can argue these are first world problems, and maybe they are, but they're real and they affect us. This is the life that we've been living, a lot of us, and we, all of a sudden, the rug's been pulled out from under us. But we don't necessarily think of it as grief, and we don't necessarily think of it as any particular process that we have to move through. And I'm here to say, I think we do. I think it's important, and I think we should be talking with friends and family about it and maybe looking at it in that way. And I also think if we don't take that on, that it comes back to haunt us later. It's cumulative. And I'm going to give you a personal example, if I can, very quickly. My mom passed away when I was 7 years old. I'm 65. This was a long time ago. It was 1962. And it was at a time when some of these resources that I'm going to talk about later, about what's available to us, were not available. Even the thinking about grief and about what it meant and the impact of it was not even out there in the public domain very much. And so basically, parents just, you know, the kid, if you had kids, you kind of had to just move them along and maybe talk to them about what happened and the loss, or maybe not. And for me, nobody talked about it. Okay, and so the reason I'm telling you this is that when I had a crisis in my teens, in my 20s, that had to do with a big loss in my life, I wasn't ready for it, and I hadn't dealt with the very big loss at age 7, and it was like dominoes. Like I got hit with that old thing all over again, plus the new one. And it took me probably until I was in my 30s to really understand. And I will also say the thing that opened my eyes about this issue, sadly, was coming to work in the hemophilia community in the middle of the AIDS epidemic. Because what I learned there was I met many people family members who were dealing with the loss of their husband, their son, sometimes their daughter or their mom, their dad. And as a social worker, with a vague awareness of my own stuff, I had the privilege to go through this with them and see many different ways of coping with that loss. And that's when I learned it's not just about death, it's about so many things. And it's cumulative, and it's so important to acknowledge it and to work with it, and to, when you get to the next one, and we're all going to get to the next one, you've got a little bit of material to use to play with to help you deal with that, and then know and build some confidence for yourself that the next time there's a trauma, you can think about what you've learned and add to that again. And it's a lifelong process, okay? But I will go back and say, this issue of grief, I think, is just a really big one with COVID and what we've been through. And for our community in particular, it's been huge for years. We're kind of moving past the HIV era. We still have some of our tough guys and women who are still with us amazingly and thankfully, and that we've lost so many people, hundreds and hundreds of people. And it's been a long haul for the bleeding disorders community around this issue. And so that's why I bring it up, because I just think it's very important to think about mental health with that being a piece of it. Okay. In terms of all of us re-entering the world now, we need to do it slowly. We need to find our rhythm and our pace. I'm aware when I'm walking on the street outdoors, and I've been vaccinated for a few months now, I always have a mask in my pocket. I don't wear it outdoors anymore, but in the other term I wanted to be sure to throw out here just for consideration is consideration of others. If somebody's walking towards me with a mask, I put mine on, just because I want whatever their comfort level is, I need to rise to that. That's me. Not everybody thinks that way, and that's okay. But I think, we need to try to be considerate of each other. I think, again, there's some PTSD here. I think we're going to have people that we know wearing masks on airplanes and other in grocery stores for another year or two. Even when it's been very clear that we don't have to, people are going to come out of this and say, I don't really know how comfortable I am, or what my comfort level is going forward. And so I think we all have to let other people figure that out and honor our own, but try to be considerate of each other as we go through this. Okay. Let's see. Another topic that I just wanted to mention around mental health, and particularly in our community, is the issue of chronic health problems and chronic pain And, you know, different bleeding disorders cause pain of different sorts. If you've got traditional hemophilia, and particularly if you have severe hemophilia, you've probably, not so much for the younger people, but if you're older, you've got joint issues in your elbows and knees and hips and ankles. And I just wanted to acknowledge there that chronic pain is kind of a blueprint for depression. And that, I think if you think about that logically, it makes total sense. If you're dealing with chronic pain all the time and it's hard to get away from it, then your world shrinks down. And that's kind of what you feel like you're looking at all the time. John did a wonderful job for 6.5 minutes before I started talking with the stuff that he showed us. It had a kind of a nice combination of Tai Chi and yoga and meditation to it. And there are some ways that we can help ourselves in a naturalistic way to try to lessen that pain and use our mind and our breathing to try to take some of the heat off of that. But it's very real. And so in terms of our community, just the knowledge, the self-knowledge that you've got this medical thing, in particular this session, a rare medical condition that other people don't have and most people don't know about. It's very hard to deal with that and to live with it and say, nobody understands what I'm going through, and they don't. We know this. We know even with factor 8 and factor 9, most people don't know what hemophilia is in the world, even now, after everything that's gone on. And so we're kind of left to think about, how do we cope? How do we go forward? What can we do to help ourselves? And what I wanted to do here is just to kind of think out loud with you about different things that we can do to get the support that we need. So at the most basic level, we need to reach out to our friends and our family if we feel comfortable doing that. And just feel comfortable talking with them, telling them what's going on, telling them how we're doing, asking them for support. The next level, I think, is, and you may have picked this up earlier in my remarks, but I'm a big fan of therapy, talk therapy. It's all tied up with insurance, which is difficult, particularly if you're on public insurance. It's not impossible, but it's challenging to get that done. Even private insurance, some therapists are not taking private insurance anymore. But if that's an avenue you're even thinking about, and I'm talking about it because I want, I'm going to show my bias here, but I really want men even more than women to think through this and realize this is okay. It's not just because I'm feeling vulnerable or I'm not totally in charge of what's going on in my life at this very moment. It's okay to ask for help, and it's okay to go and find it. How do you do that? You have a social worker at your treatment center. That person might be able to be the person that you want to talk to if they're licensed and you're comfortable with them and they have the time to do it. They can also refer you. They can help you look at your insurance network and find a way to find a therapist that you could work with. Your primary care physician could also do that for you. And those two practitioners are kind of a really good conduit towards seeing a therapist if that's something that you think you'd like to do. In a broader sense, in terms of support and resources, excuse me, your local Hemophilia Foundation chapter has resources and has staff that maybe can help you find support groups or the kinds of things that you would really like to have in your life. NHF, of course, has a ton of resources, as does the Hemophilia Federation in Washington, D.C. There are online resources that you can learn about depression and anxiety. You want to be careful with that because self-diagnosing and you can get a little bit in deep water online because you're going to be reading about a million different approaches and a million different things. One place that I kind of trust, and I'll just throw this out if you want to Google it, is the Mayo Clinic in Minnesota. They just seem to have a pretty reputable website, and they have a lot of really good information that can at least give you some groundwork for what you're looking for. I also wanted to mention it in this little segment about the film that was made last summer that was shown at the NHF meeting in August called Let's Talk by Believe Limited, and Patrick James Lynch was very responsible for getting that film made, where they interviewed a number of people in the hemophilia and bleeding disorders community about their own experiences with depression and how they handled it. So it doesn't just, it's not a sob story. There's some hard, sad stories there, but they all talked about what they did to help themselves and how they reached out to other people to get that help. So that's, I don't know, NHF might be able to direct you to how to watch that film online. I would assume somebody there would know. And I highly recommend it. They did a nice job on the film. One last thing that I'd like to talk about before we go to any questions you folks have is, I've talked a lot about depression. There are lots of different levels of mental health challenges and mental illness. Some of them are very serious, psychosis and some of the things that you would see in the diagnostic manual, the DSM. And those really need to be under the care of a psychiatrist and a medical doctor, because people can get in some really deep water. Bipolar disorder is another one that many people live with, and there are medications that help people get the balance and brain chemistry that they want so that they can function and not feel like they are overwhelmed. And the piece that is more common for most of us that I didn't really talk about too much is anxiety. And I just wanted to bring that up at the end because I think it's very common. I think just like depression, all of us have experienced anxiety situationally, and some of us have it in other parts of our life. Some of us are very aware of it. Some of us are not. I'm going to give you one more personal example, which is in the last 5 or 10 years, I have been taking the bus to work instead of driving. And during COVID, the buses kind of shut down and there were very few of them. And so I had to drive. And I work in San Francisco. I live in Sonoma County. So it's about an hour to get to work on the freeway. And I realized getting in my car and driving over the Golden Gate Bridge, poor me, right? But the heights and just the traffic and stuff, I had a lot of anxiety, and I was shocked. And I thought, I'm not an anxious person. I'm pretty mellow. But the more I thought about it, the more I realized I have had anxiety in different parts of my life since I was a kid. And I just was in denial about it, like a lot of people are, and a lot of men are. I got my act together and blah, blah, blah. Well, I didn't. And it's been a challenge to drive. And what I want to say about it is, I think anxiety is something we really can work with medication. There are anti-anxiety. To all of you is one of my favorite things, which is the notion of self-chatter, self-talk, the way that we do internal dialogues with ourselves all the time, all day long. We're not aware of a lot of it. And a lot of it is not positive. a lot of it's negative, and it's telling us what we're not good at and what we don't know how to do. And what I want to say is that there are ways, and I think meditation is part of this. Affirmations, it sounds kind of Marin County goofy, but saying positive things to yourself every day, maybe particularly when you get up in the morning, and even just kind of working with those thoughts in a conscious way over time to change them, to retool them, so that you can, the incoming messages are more positive. I find myself as a HTC social worker talking about this, particularly to young people, because it hurts my heart to see them struggling with that negative self-talk at such a young age. And I think, you don't need to do this for the next 20 or 30 years. Get a hold of it now and turn that ship around and replace that stuff with something that's positive and useful and that's going to help you feel better and do better. Not as easy as it sounds, but very possible. There's a therapy form of therapy called CBT, which is cognitive behavioral therapy. And there are practitioners out there who help people with it, but it's all about how we think and what the ways in which we think and how they affect our life every day, every minute, really. So just something else to think about. There's about 9 minutes left, and I think I should stop talking and invite anyone who has questions to ask them, and I'll do my best to answer them or get back to you somehow with an answer if I don't have one. And thank you for having me.
Thank you
I have one more thing to say. One more thing to say that I promised to do. There is something called the National Suicide Prevention Lifeline. Okay, this is kind of when things are really difficult. It's a good resource to have on hand for yourself, for your friends, your family. You can go online and get it. The number is 800-273-8255. 24 hours a day. I think they route you back to somebody more local to where you live, but there are trained people there to talk to you. And the last thing I want to say in my presentation, circling way back to the beginning about physical health versus mental health, next year, 2022, we have 911 for medical emergencies, right? There's going to be a 988, not till next year. I want you to remember that. It's not in service now. In 2022, there'll be a number 988, which will be for psychological emergencies and for mental health crises. So in a year from now, you'll be able to dial 988 and get somebody on the line to talk to you. Okay, now I'm done.
Thank you so much, Dana, for sharing all of that wonderful information with us. We have had quite a great chat going on here on the side while you were talking, and there's also a lot of wonderful questions that came in as well. So I want to relay some of them to you for our community. So one kind of goes along with what you were just saying a little bit with when somebody is in crisis. So if you, as a support person of somebody with a bleeding disorder, somebody you're living with in your family, know that they really need to get mental health counseling, but they completely refuse to go to do so, what are some ideas of what you could do?
Well, I mean, it's the first thing that comes to my mind, because if you push somebody really hard on that point, and I want to remind you of something I said a minute ago. And again, I've been doing men's support groups for 33 years. There's a whole lot to overcome in terms of, particularly in terms of men's view of themselves. And so if you're saying you have got to go see a therapist or something, it's not going to work. It's just not, you're going to push them further away. And I think, the first thing that comes to my mind is a step or two down from that, which is, I know you're really suffering, would it help at all to talk to one of your friends or one of your friends with hemophilia who really would understand what you're going through? Would that help? You know, because if it would, I'd really love for you to call Joe or Tom or whoever it is, and you can say with love and with care, this is hard on me too. This is hard for me when you're suffering so much, and I feel like I can't manage all of it myself. I want to be here for you, and I want to help you, and I want to support you, and I will, but I need you to widen your circle a little bit. And that might be a first step towards some awareness, like, oh, you know, maybe I could talk to my friend who has bad joints or is in pain all the time too, or is depressed, and just, you know, bounce some ideas off of them. So yeah, it's tough.
Absolutely. Absolutely. Now, another question that came in from our chat here is it true that when somebody is bleeding so much that they lose serotonin and thus fall into greater depression?
Wow. I would have to ask one of my nurses or my medical director about the science of that. I don't know. I can't say that I know the answer. If there's some way, I'd be happy to ask, unless we've got somebody on who knows, if there's any physicians or nurses on. But I'd be happy to find out and try to get back around to this person to answer the question.
Absolutely. Now, another question that came in is how can somebody actually cope with chronic and acute pain?
I'm going right back to John and right before I came on here. Not just native stuff. I mean, I think a lot of people who are in pain look at that and say, give me a break. You know, you gotta be kidding me. But here's the thing. Everybody's different. Everybody's pain threshold is. I know with our patients here in San Francisco, we have some guys who are taking enough OxyContin to kill a horse, and they're functioning and working and productive members of society. But that's what they're doing, and that's working for them. But I'm sure there's some consequences for that down the line. But we've also got guys in their 60s who have all the damage from pre-factor years of hemophilia, who are taking nothing, and who have, you know, they're toughing it out, but they're also doing alternative stuff. They're doing meditation. They're doing movement stuff and mind training. And there is a lot of research about pain and chronic pain and the role of our mind and our thinking in it. Mm-hmm. Excuse me. And I know that's hard for people who are in pain to even think about or consider that as a possibility. But I think, again, I'm always the first one to say, see if you can find somebody. If you want to try something different, see if you can find somebody through your team, your nurse, or your social worker, your treatment center. Can you, this is the patient saying this, can you put me in touch with someone who is not on all these pain meds? Excuse me. Or I'd like to talk to one of my peers who's doing things differently and see if I can learn something from them. So
yeah,
that's what it does.
Absolutely. Another great question coming in here. Now, have you seen a greater need for mental health in marginalized communities with rare bleeding disorders suffering because they were already struggling during the pandemic and now?
Yeah, I think this has been an issue that's been in the news since the beginning of the pandemic about marginalized communities of all kinds kind of being on the short end of the stick of resources. And again, it's real, and I'm not going to say it isn't. And I feel like the only thing to try to do, and I know it's hard when you're struggling, but is to marshal whatever resources you have in your community and in your family and in your circles to find the help that you need. Just don't back off, don't disappear, but try to advocate for yourself or get someone who can do that with you and for you to help you do it until you find what you need. Excuse me.
Now, another great question that came in. Now, there seems to be a lot of anxiety now that we are slowly but surely moving past the pandemic and into our new normal, and whatever that new normal is actually going to look like. Now, if I'm a parent of a child with a bleeding disorder, they obviously have suffered a lot throughout this year as well. Are there particular signs and symptoms that, as a parent, I should really watch for in my child?
I'm not an expert on pediatrics. I did work with the kids for a few years at the beginning of my treatment center career, but not so much in recent years. But I think I would really talk to the social worker at your treatment center and your pediatrician about that, and the physician or the nurse that you trust at your treatment center. And the main things I think that are most common is just withdrawing, social withdrawal. I mean, some kids are not super social, but if you've got a child who has really enjoyed being at school and being with their friends and they don't seem to be having that same enthusiasm, I think that's a sign that they're struggling with reentry. Acting out, the opposite of that, just behavioral acting out, is probably a way of them saying, this is really hard for me. I think we're going to see the impact of this for a long time to come, because I think particularly with kids, it's so hard for them to understand what happened and why it happened. And, adults are having trouble grasping it. So for children, it's 10 times harder. But I think my best advice would be to get in touch with the psychosocial people and your pediatrician or your pediatric hematologist and see what their advice would be.
Mm-hmm. Another great question that came in is, how can we, as a community as a whole, really support each other as we are moving past the pandemic?
Mm-hmm. Reach out to your friends, to your community members. Find the oomph and the courage to attend events. Wear your mask if you want, or bring it in case other people want to wear them. Just slowly and carefully re-enter the bleeding disorders events. I know that we're all burnt out on Zoom. And so when your chapter or your treatment center is offering something in person, make the extra effort to go and talk about it. Just discuss with your friends and colleagues and community members what it's been like and how hard it's been and how hopeful you feel, hopefully, about moving forward and kind of getting back into old routines. And one last thing about that, this is just a little quirk of mine, but don't forget any lessons any of us may have learned from this time too. Just about gratitude, about it's been very hard and very isolating, but it's been really important to understand all the things we take for granted every day. And keep that in mind too, and talk about it. Share that with your friends and ask them to tell you about that too. So.
Absolutely. Okay, I want to ask you one more question, and this is really one that's coming from me too. So I always love to think about collateral beauty. about something positive that came along with whatever we're going through. So I wanted to ask you, what is maybe some of the collateral beauty that came out of the pandemic? Is there anything positive that we learned throughout this last year?
I just saw that movie about a week ago with Will Smith. I don't know if anybody's seen that movie with that title. It's very powerful, and it's all about loss and pain, and it's an amazing film. It's different for everyone. I mean, I think it's important to ask the question, and Lena, I hope you're asking all of us who are here today to just think about that. And what it means is just in the deprivation of COVID, what awarenesses did you have? I'm going to give you one of mine just as a way to leave this session. But I mentioned earlier, I took the bus to take the bus to work, and now I've been driving. But right, like week 1 or 2 of the pandemic, when California shut down, the buses were still running. So this was last March 2020, and I got on the bus, and I was the only person on the bus. There's usually 60 people on the bus. So I had my own bus driver, felt like I was in a limousine. I got off the bus, went over the Golden Gate Bridge. I got off the bus in San Francisco near the Presidio and the Palace of the Fine Arts, which is this beautiful part of San Francisco, very verdant, not a lot of houses. And I'm standing there, and it's 9 o'clock in the morning, and it's totally quiet. There's no traffic. There's no people. And I just thought, man, this is amazing. I mean, it's like this kind of perverse gift of this time that nobody can go anywhere, and people are working from home now. I was working 1 day a week at my office, and I thought about global warming and climate change. I thought about just how quiet everything was and how peaceful it was, and about how when this was over, it was going to come roaring back just the way it was before. And I just felt so appreciative that I had this up. It was like I dropped down from another planet and was in a beautiful place all by myself. And I just wanted to appreciate it right then and there, because I knew it wasn't ever going to happen again. So we all have some of those, I think, and we should try to remember them.
Thank you so, so much. And I think that's a beautiful note to end on here as well. So with this, Dana, I just wanted to thank you again for joining us on this Saturday and sharing your experiences and all of your great input and your lens with our rare bleeding disorder community. I definitely appreciated this session so much. As we all went through this pandemic together, it really impacted all of us, and the re-entry impacts us as well. So with this, I truly want to thank you again